Hi friends, welcome all of you to the class of clinical features of gingivitis. In the clinical features, which is characterized by any of the following clinical signs like the redness and sponginess of gingival tissues, then bleeding on slight provocation, changes in the contour of the gingiva, then presence of calculus or plaque with no radiographic evidence of crestal bone loss. If bone loss occurs, then we know that we will say that as a periodontitis. In the histopathology, we can see the ulcerated epithelium. So in the last class, when I discussed about the stages of gingival inflammation, I mentioned about the ulceration of the epithelium. So those who have not watched that video, please go and check it out. In the course and duration, this is divided into actually three: acute gingivitis, chronic gingivitis, and recurrent gingivitis. By the term acute, we know that it occurs suddenly, sudden onset, and for the shorter period of time, and this is painful also. So chronic means by the word we know this is slowly occur, and for the longer duration this is painless. Then recurrent means reappears. This infection which reappears after having been eliminated by treatment or after disappearing spontaneously. Then this gingivitis is divided into localized and generalized gingivitis. By the term localized, we know this is confined to the single tooth or a group of teeth. Generalized means involves the entire teeth. Then this also divided into marginal and diffuse. If Can you see in this picture? This is the inflammation, the gingivitis. Inflammation of the gingiva can be seen only in one teeth. So this is called as the localized marginal gingivitis and can be seen on the margin of the gingiva. Whereas generalized marginal gingivitis means the gingivitis on the margins of the gingiva, but we can see almost all the teeth. Then localized diffuse gingivitis. Diffuse means it affects the gingival margin, attached gingiva, and the interdental papilla. So localized diffuse gingivitis means only few teeth are affected, but the gingival margin, attached gingiva, and papillary area are all affected. And generalized gingivitis, diffuse gingivitis means it affects all over the teeth, also the gingiva, attached gingiva, and the papillary area. Then we have to see what is the hallmark of gingivitis. So this is like evident. Definitely these all changes will be present in the gingivitis cases. If you see this picture, this is the healthy gums and this is the case of gingivitis. So when you see the color, healthy gingiva which is of coral pink color, but in the case of gingivitis it has become more reddish in nature. Then contour, this is the well demarcated and knife edge and scalloped area, but here we can see the rolled and bulbous papilla. And when we talk about the consistency and texture, in the healthy gums we can see the gingiva is firm and resilient with stippling of the attached gingiva, whereas in the case of gingivitis we can see the edematous and the stippling cannot be seen. So this is the classic difference between the healthy gingiva and the gingivitis. Then clinical findings. So we can see bleeding on probing, definitely that will be there. Then changes in the gingival color, consistency, surface texture, position, and contour. So these all area so changes can happen sorry. So changes can happen in all these areas of the gingiva. So first we will talk about the bleeding on probing. Actually this bleeding appears earlier than a change in the color or any other visual signs of inflammation. When I discussed about the stages of inflammation, I explained about the signs of gingival inflammation. In that I talked about the initial signs, that is in the stage 1 and stage 2 we can see the GCF production and the bleeding on probing. When it goes to gingivitis grade 2, 3 and 4, more evidence of inflammations can be seen. So the two early earlier signs of gingival inflammation are the GCF production and the BOP. So this bleeding can be caused by local factors and also associated with the systemic changes. Local factors, most common local factor is the chronic inflammation. So in the histopathology, this also I discussed in the last class. We can see the dilation and engorgement of the capillaries and thinning or ulceration of the circular epithelium, so that there won't be any protection. Then cellular infiltrate, especially on the site of bleeding, we can see the lymphocyte as a most common cellular infiltrate, especially in the stage 2 gingivitis. Whereas in the initial stage, like stage 1 gingivitis, we can see the neutrophil production more. And the changes, systemic changes are the hemorrhagic disorder, platelet disorder, other coagulation defects and hypoprothrombemia, then multiple myeloma, hormonal replacement therapy, pregnancy and oral contraceptives, menstrual cycle, medications, these all are the systemic changes. So how this bleeding on probing we measure clinically is that to explore the mild edematous gingivitis, a probe should be introduced into the bottom of the gingival sulcus, and after few seconds we can see the bleeding appears here. So this is the examining of the bleeding on probing. The next we will see the changes in the color of gingiva. So this is an important clinical sign of gingival disease. Actually, the color changes of gingiva is determined by the number and size of the blood vessels and epithelial thickness and quantity of keratinization and pigments in the epithelium. So these all factors are determined by the these color changes of gingiva are determined by these all 4 factors. Then I will talk about some cases and how the gingiva appears. So in the case of chronic inflammation, which intensifies the red or bluish red color. So the gingiva would be more red or bluish in color. This bluish hue is due to the venous stasis. This also I discussed in the last class. And these color change, this is due to the vascular proliferation and the reduction of keratinization. And these color changes that happens, that starts in the interdental papilla and the gingival margin, and then which spreads to the attached gingiva. In case of ANAC, that is the acute necrotizing ulcerative gingivitis, the color change that can be seen only in the marginal gingiva. If you see the picture, you will understand that the reddish, more red color can be seen along the marginal gingiva and not affected the attached or other areas. But in the case of herpetic gingivostomatitis, that can be seen especially in children. So this case, we can see the reddish area in a more diffuse manner because it affects the, it already spread into the attached gingiva and other areas. And the acute reaction to chemical reaction, in such case we can see the patch like or diffuse area. Then according to the intensity, this color change can vary. Initially we can see increase in erythema, but if it could not, if doesn't worsen, then this is the only color change until the gingiva reverts normal. But with the severe acute inflammation, this red color gradually becomes dull and whitish gray color. This gray color is due to the tissue necrosis. Then metallic pigmentation. This is due to the heavy metals like bismuth, argon, mercury and silver. They produce black or bluish line in the gingiva that follows the contour of the margin. If you see the picture, you can you'll understand the patient who take the bismuth therapy, then we can see the linear discoloration, blackish discoloration along the contour of the margin. But in this case, this is the amalgam restoration, so the discoloration of the gingiva due to this metal. So this is the metallic pigmentation, and the perivascular precipitation of metallic sulfides can be seen in the subepithelial connective tissue. Actually, this kind of gingival pigmentation, this is not as a result of systemic toxicity, and it occurs only in areas of inflammation in which the increased permeability of irritated blood vessels permits the seepage of metal into the surrounding tissues. So common sites are the inflamed gingiva, then the mucosal areas that are irritated by biting or any abnormal chewing habits. So the treatment is the treating the inflammatory changes without discontinuing the metal containing the medication. Then color changes associated with systemic activity. This is broadly divided into endogenous oral pigmentation and exogenous oral pigmentation. Endogenous is again divided due to the melanin, bilirubin, and iron. So melanin, in the normal case we can see the melanin production, but in disease case this melanin production can increase more, especially in Addison disease we can see the bluish black to brown isolated patches, but in the Peutz-Jeghers syndrome we can see the melanin pigmentation in oral mucosa and the lips. When we talk about the bilirubin, we can see it is stained by bile pigments. So in case of jaundice, the color would be yellowish oral mucosa. Then iron. So deposition of iron in hemochromatosis. In this case, we can see the gingiva as a blue-gray pigmentation. Then exogenous pigmentation are the atmospheric irritants, tobacco and amalgam implants. Atmospheric irritants are due to the coal and metal dust, and also from the coloring agents in the food and from lozenges. And tobacco, this tobacco usage can cause the hyperkeratosis of gingiva, which induces the increase in the melanin production. Then amalgam implants, because of that we can see the localized bluish black area. And the treatment is definitely the laser treatment. So selective ablation using a laser beam with a wavelength that is specifically absorbed by melanin effectively destroys the pigmented cells, but that should not damage the non-pigmented cells. Then changes in the gingival consistency. So this varies from the chronic gingivitis and the acute gingivitis. In chronic gingivitis we can see the little soggy areas and softness and friability. Then sometimes we can see the firm and leathery consistency. And in the case of acute gingivitis, we can see the diffuse puffiness and softening of the gingiva, then slowing with grayish and flake-like particles of debris, then vesicle formation. Then changes in the gingival surface texture. So we know in the normal case we can see the stippling of the gingiva. Actually this is like a many small depressions and elevations which gives a tissue as a orange peel appearance, whereas in the case of chronic gingivitis the gingival surface is smooth and shiny or sometimes firm and nodular. If you see this picture, you will understand the gingival surface is smooth and loss of stippling and swelling and discoloration, everything can be seen in this case. And in this case the firm or nodular gingiva, in this chronic gingivitis we can see the firm and nodular gingiva because the fibrosis production that dominates in the inflammatory process. Then changes in the gingival position. So when you see the if you see the gingival recession case, in this picture you will understand properly that actually this gingival recession is a common finding. In such case only the gingival position can vary. So prevalence, extent and severity of gingival recession that can increase with the age, and more can be seen in males. So exposure of in the case of gingival recession, exposure of root surface by an apical shift in the position of the gingiva. When you see this picture, you can see this is the actual gingival actual position, and this is the apparent position. And this apparent position is the level of the crest of gingival margin. and this is determined actually used to determine the severity of the recession, but the actual position we measure from the level of the coronal end of the epithelial attachment of the tooth. So this is used to determine the clinical attachment loss. This is visible, this area, this distance is hidden. So what all are the etiological factors for the gingival recession? Mainly the faulty toothbrushing technique and tooth malposition and friction from the soft tissues, gingival inflammation, abnormal frenal attachment and iatrogenic dentistry. Then now we will discuss about the changes in gingival contour. So these are primarily associated with the gingival enlargement. Then you may familiar with the two terms like Stillman cleft and McCall festoon. And the Stillman cleft is this. Can you see the depression, apostrophe like depression? So this is used to describe a specific type of gingival recession that consists of a narrow triangular shaped gingival recession. So as the recession progresses apically, the cleft becomes little more broader and thereby exposing the cementum of the root surface. But whereas in this case, McCall festoon, this is used to describe a rolled thickened band of gingiva. Can you see this thickened band? So this is usually seen adjacent to cuspids when recession approaches to the mucogingival junction. So this is all about the clinical features of gingivitis. Thank you.